Congresswoman Jackie Speier needs no introduction. She's been a longtime friend of this medical center and a tireless advocate for veterans. Please join me in welcoming Congresswoman Jackie Speier.
Can you hear me? You can. All right. Well, thank you, and it's a privilege to be in this room with all of you who could probably tell us stories that would make our hair curl. For those who have curly hair like me, maybe straighten it. But in any case, we're here to say thank you. We're here to say veterans first. And we're here to find out where the kinks are and to straighten them out. This is going to be a constructive gathering. Now, so that you can have a perspective on this, first of all, Bonnie Graham, thank you for your leadership. Thank you for being here. Thank you for your service to our veterans and to our country. I have one goal in mind. It's a modest goal. It's to fix the VA system. Now, I met with the Inspector General last week, talked to him on the phone 2 weeks earlier. Many of these problems that are now hitting the media today are problems that we knew of back in 2005. There were IG reports back in 2005. So when we think about who to point the fingers at, we have to point the fingers at Congress, we have to point the fingers at the administration, and we've all got to take responsibility because we haven't fixed what is broken and what we were alerted to back as far away as 2005. Now, having said that, we also have a limited number of resources. And so we're going to have to fix it in a manner that is prudent. But that does mean that when the Congress passes a law and says every patient should be seen in 14 days, well, then you've got to deliver the resources to those veterans hospitals around this country so they can deliver the services in 14 days. And you have to put performance standards into place. Kaiser is a great example of a system where each physician has 2,000 patients. VA docs have 1,100 patients. Kaiser has a requirement that you see anywhere between 14 and 16 patients a day. I don't know if there are performance standards here. I was told by the Inspector General that there aren't. That a physician who does colonoscopies, for instance, isn't required to do X number of colonoscopies a day. So we need to be accountable on every level. I need to be accountable. The physicians here at the VA need to be accountable. The administration has to be accountable. And all of us as Americans have to be accountable. We're willing to send our men and women to war. And if we're willing to pay the price tag of going to war, then we've got to be willing to pay the price tag after the war to provide services to our veterans, pure and simple. Now, what I will say to you is that it does take money, and Congress has got to be willing to fund the VA at a level to provide high-quality service, prudent service, and timely service. Now, last week or 2 weeks ago, my colleague to the south, Congresswoman Anna Esch, and I had a town hall at the Veterans Hospital in Palo Alto. And I will tell you that we found out some things that were probably very similar to what we'll find out here. You can't run a scheduling system on software that's 30 years old. Just can't do it. Now the question is, then why didn't we replace that software years ago? That's a good question that we should be asking people. You can't run a system where the phone system is also 30 years old and expect not to drop calls, expect not to have people waiting long periods of time. It just doesn't work. Now, we passed a law that says chiropractic services should be available. Except chiropractors are not on staff at the VA hospitals. Now, in some respects, you might say, well, it's more prudent to have veterans go to a fee-for-service chiropractor in their community because they can't travel long distances to come to the hospital, and that may in fact be the case. We also found out that there's a long wait for dental care, egregiously long wait for dental care, and egregiously long wait for hip and knee replacement. And in Palo Alto, they were actually contracting out to have that service done at Stanford Hospital. Now the question then we've got to ask ourselves, is it prudent to farm out that work, or is it more prudent to hire orthopedic surgeons who can do the surgery at the VA? So we've got to make sure it's quality, but it's also fiscally prudent as well. Now I have spent the last 3 years working on the VA office in Oakland. Congresswoman Barbara Lee and I had 2 sessions right here in the city, what we called VA Fix-It meetings, where packed rooms of veterans that had disability claims waiting for years and years and years. Woefully unacceptable. I went and visited the VA in Oakland, and it was all paper files. And whenever you called and you get surprised when someone says they've lost your file, well, it's no surprise because nothing was computerized. Now they're in the process of scanning all VA files so that they will be electronic, which over time is going to make things work more smoothly. But that hasn't happened completely yet, hasn't even happened, I think, 50% wise yet. So more work that needs to be done in that regard. I will tell you, once we got on that issue and stayed on that issue, and I want to pay special recognition to Mark Nagalis. Yes. Where are you, Mark? Stand up. Yes. In the back. And Richard Steffen in the front here. These 2 men have done an incredible job. They've done an incredible job of advocating on behalf of veterans. So much so that they can proudly say that more than $4 million has been returned to veterans who have called my office with disability claims that were pending for long periods of time. One of whom, and I will remember this case for the rest of my life, one of whom was a veteran, 90 years old, in a wheelchair at our very first Fix-It meeting. And his caregiver spoke on his behalf. He says, this man is 90 years old. He served at D-Day and the Battle of the Bulge. He has had a claim pending for 2 years, and he just got a letter from the VA saying he had to go back to his doctors and be reassessed for the level of his disability. And I turned to the director of the VA office and I said, it's our fault, it's the government's fault that this wasn't processed in a timely fashion. So at this point, use what you have and determine whether or not this veteran is eligible for the disability claim that he has filed. 10 days later, this veteran got a phone call from the VA giving him 100% disability. He called up, he was teary-eyed, although I couldn't see him over the phone, and said how grateful he was. But he said that now he and his wife could afford to hire someone to come in and provide some attendant care. Now that was maybe 2.5 years ago, thereabouts. His wife passed away after maybe another year, and then very recently he just passed away. But for the last couple of years of his life, there was some degree of peace and comfort in knowing that he had the care. And that is what our job is, to make sure it happens for each and every veteran. And that's what we're going to make sure happens. Now, I spent the morning on the phone at the Palo Alto VA hospital at the patient advocate office, fielding phone calls from veterans who weren't getting satisfaction. This one saint of an employee at VA Palo Alto fielding call after call after call. Some of these veterans, because they were on voicemail, had called 5 or 6 times. And she was responsible for triaging all of these calls. So we need more help in that office. And we need to find a better phone system. We need to find a better software system. And we need to hire enough physicians and nurses to do the job. Now, the new director of the VA testified before Congress last week and said that we need another 1,500 more physicians in the VA system and another 8,500 more nurses in the system. And that's a pretty staggering number. It's like $16 or $17 billion. But if that's what it's going to take to give you the kind of quality care that you deserve, then that's what we're going to have to do. So, I think with that, are we going to open it up to questions, or are you going to speak?
I'll speak for just a few minutes.
Okay. So, this is all about trying to fix the system. There's people of good faith who work here. We want to make sure that you, of good faith, get the services you deserve. So with that, let me turn it over to Bonnie Graham.
I'm really pleased at the turnout here because we can only get better at what we do if we hear from all of you and the things that we really need to focus on. And so that's very important to us on an ongoing basis. I wanted to share a couple of things with you, but before I start, I wanted to introduce you to our leadership team. And sitting over here is Dr. Nico, if you could just stand so people, who's our Chief of Staff. And next to her is Shirley Pakula, our Nurse Executive. And next to her is Wafa Samara. She's our Associate Director who deals with operations. And over there, Natalie, if you could stand, as our Director for Patient-Centered Care. And there's a bunch of other folks here as well that are employees or veterans. I recognize some faces, and then some faces are new to me. So I want to just share very briefly a little bit of my background because I think it's important for where we're headed. And I came here to San Francisco 10 months ago, and I had been in Washington, D.C., working for the National Office of Patient-Centered Care for 3 years. During that time frame, I had the opportunity to travel nationally to look at best practices, both within the VA, but also the private sector, to try to look and see what really is best, to try to pull that in and see what we want to really aspire to as an organization. And so I think that's really important. So I come here with really a passion to focus on you, the veterans, at the center, and we are your partners. And in order to best serve you, we have to understand what really, really matters to you. Not just your broken bone that you come to see the provider, but what's really important in your life that can really motivate and help us partner with you to develop programs that you can be successful with. And so I want to tell you a little bit what our strategic focus is, because it's very applicable to this conversation. And so the organizational health, the patient-centered care, really focusing on the veteran and the employees. We need the best employees in order for them to provide the best patient-centered care to all of you. And so with that, we have embarked on a journey to improve in this direction, and we do have Veteran Family Advisory Council so that we get some input. We also have a dedicated patient-centered care office that Natalie leads, and that is growing as we further get information and feedback. Natalie and her team are conducting focus groups with veterans to really, on a smaller scale as well, get a feel for what is really important and develop themes so that we can put that into our strategic plan. And then the most interesting thing is, as we have projects, as we have medical care teams, we're putting veterans on those teams because the veterans have a different perspective than the providers and bring very valuable information to us. The next several things are really getting at access, and that is inpatient flow, so that we can get people into the system and get them at the level of care they need. The ambulatory care or clinic access, outpatient care, we really see that there's processes and different systems, things that can improve so that you can really feel the results of that. Space is a limitation for us here in Fort Miley, and we've tried to get really creative. And also dealing with the fact that we have a lot of rural veterans. We have a huge increase in telehealth and various ways to reach out. We also have been working with City College. There's about 1,100 veterans there that we bring services there so that it's not just in the setting that care should be provided. Outreach to veterans is multifaceted, and we have folks dedicated to that to look and see how we can reach out so that we can help from a eligibility benefits perspective, bring our partners in from VBA, and also really educate people as to all the services that are currently available and find out if there's others that currently aren't, what we need to do. And then the biggest thing, and I think this is in part what Congresswoman Speier was talking about, is aligning our resources to those priorities and making sure we can do what we need to do. So next, if you could, Judy. So our access initiative continues in that we've gotten better at putting together data. We actually have teams who are now looking at all the data as far as it relates to appointments, access, so we really know and we have a very good handle on what the situation is. We're trying to put in better systems, and of course Congresswoman Speier referred to the scheduling, and that is a challenge, and people can't toggle back and forth quickly and can't respond to you as quickly and as easily as we would like. And so we're trying to look and see how we can work with that currently, but of course a new system that was more technologically advanced would be critical. And then I won't go into all those you can see on the screen, the areas that we're regularly providing training that very much relate to a lot of the issues that have been coming forth are really critical, and what we need to know if there's other things that we can really do and educate our staff, and in a sense, we have to educate one another. So I'm thrilled that you're here and want to hear more. I think Judy had it planned for us to sit up here so that people can ask questions, and Judy, I'll let you.
Thank you. So you see that there's a mic in the middle of the room. We're going to ask if you could please go up to the mic and ask your questions so that everybody can be heard. And also those that are videotaping can get recorded. There are comment cards. Congressman's staff has comment cards. If you can't get to the mic, please feel free to fill out a comment card. If you'd like a comment card, raise your hand, and the staff will get you that card. We ask that you not talk about your personal health care issues here. We do have staff available to provide support. We have staff from our patient-centered care office. The Veterans Benefits Administration is in the room. as well as staff from our member services. So we're happy to make them available to help you with your specific concerns. So Congresswoman, if you guys are ready, go ahead and begin. Go ahead, sir.
Thank you. My name is Charlie Hall, and just to give you some background, my father and my uncle both served in World War II. I guess I turned this off. You can probably hear me without it.
You're good.
I joined the service at 17 in 1961. I was in when Kennedy did the Cuban blockade. I was at a nightly Hercules missile site, and I won't tell you what that was like. I got out finally in 1967, but I also worked in the Classified Documents Control Center at Fort Knox and had a top secret cryptographic clearance, so I can't tell you much about that. But I will say this, I've been in the VA system for a number of years, and that's a different story than what I'm going to go to, but I've got doctors right here, Dr. Strauss. I've been a patient here since he opened the clinic. I've been happy with the service at the VA here in San Francisco. The only problems have been the bridge and the gap. And I've had to, I'm a co-pay person, I don't have any injuries that are known other than mentally. And so I pay my way for whatever I get. But I recently had to coordinate certain procedures with the VA and the UCSF dental school. All of my upper teeth needed to be removed surgically. That was done right here in this hospital and worked very well by Dr. Sam Peter. He's a resident surgeon at UCSF. My brother was a nicely board certified general surgeon, so I'm a little familiar with medicine.
All right, your question is?
Sure. Can you raise it up? Okay, well, you can hear me with or without.
I can hear you now.
So, I'll just say this, that my experience has been very good. My career was in the processing industry. My bank that I worked for 12 years was in Louisville, Kentucky, where I'm from. And we started as the 13th franchisee in the original Bank AmeriCard, if you remember that, which is now Visa. I retired from Visa's world headquarters in the position of working with every processor linked to the organization in the United States. I'm very familiar with technology, systems enhancements and changes, and I'd be happy to assist if it's possible whenever you get a team together to work on that. Other than that, that's all I have to say.
All right, thank
you
you.
very much.